Hello, my name is Arnela Zukic. I'm a student at Oakland University, currently enrolled in Nursing 4571, Contemporary Nursing, Professional and Ethical Issues, instructed by Dr. Linda Polly-Droulard in the Department of Nursing. Today's date is April 19th, 2026, and in this video I'll present my professional opinion on whether Bachelor's of Science in Nursing, or BSN, should be required entry-level degree for nursing practice. My perspective is supported by current peer-reviewed research and policy discussion. The peer review article that I selected is by Linda H. Aiken, titled Nurse Staffing and Education and Hospital Mortality in 9 European Countries, published in The Lancet in 2014. In addition to this article, I reviewed 2 required studies. In 2021, BSN Outcome Study, and as well as a 2022 article, BSN Mortality Study, as well as a policy article discussing the BSN in 10 law. The study by Aiken examined over 400,000 surgical patients across 9 different European countries. The research found that both nurse staffing levels and nurse education had a direct impact on patient mortality. Specifically, though, they found that for every 10% increase in nurses holding a bachelor's degree, there was a 7% decrease in the likelihood of a patient death within 30 days of surgery. The study highlights the importance of higher nursing education and in improving patient outcomes. Similarly, the study by Lanster in 2021 found that the hospitals had increased their proportion of BSN-prepared nurses over time, experienced significant improvements in patient outcomes. This is suggesting that investing in nursing education has a long-term benefit for healthcare systems. The study done by Porat in 2022 further supports that these findings demonstrate that the hospitals with higher proportion of BSN-prepared nurses had lower rates of surgical mortality. This study is emphasized by the variation of education levels across hospitals and the significant impacts in patient safety. Lastly, Nurse.com article discusses that BSN in 10 law explains that in New York, registered nurses are required to obtain the BSN degree within 10 years of their initial licensure. This policy reflects an effort to improve nursing education while still allowing accessible entry into the profession. When you're comparing these articles, there's a clear pattern that pops at you. All 3 research studies consistently show higher levels of nursing education are associated with better patient outcomes and lower mortality rates. The Aiken study provides a large-scale international evidence, making it highly influential and foundational. The Lancet study builds on this by showing the improvements over time, indicating that the BSN education has lasting positive effects, whereas the last study by Porat shows the study further strengthens the evidence by focusing on specifically mortality variations across different hospitals. While the research articles focus on the clinical outcomes, the Nurse.com article introduces a policy perspective. It provides practical solution by supporting the law of gradually increasing educational requirements through the BSN in 10 law, rather than requiring a BSN immediately upon entry into the practice. My personal opinion with the evidence: based on the evidence presented in these articles, I believe that a Bachelor's of Science in Nursing should become a standard for the nursing practice. However, it should not be required immediately as a sole entry-level degree. The research clearly demonstrates that BSN-prepared nurses contribute to improved patient outcomes, including lower mortality rates. As healthcare becomes more complex, nurses expect to have a strong critical thinking and leadership abilities, as well as a solid foundation in the evidence-based practice, all of which is emphasized in the BSN program. However, requiring a BSN is not the only entry point that the nurses could create. They could create barriers including financial burdens, reduced accessibility, and potential worsening of current nursing shortages. The associate degree programs provide an important pathway for many students to enter the profession. For this reason, I believe that policies such as the BSN 10 law offer a balanced and effective approach. They allow individuals to enter the workforce while still promoting advancement of education over time. Overall, evidence is strongly supported in the values of the BSN education, but a flexible and gradual approach is the most practicable and equitable solution. Thank you for taking the time to watch my presentation. I appreciate your attention and consideration of this important issue in the nursing practice.